we're already seeing in the US a health disparity component to this. So, one of the reasons why people get very sick with COVID-19 is underlying diabetes and hypertension. And particularly in the African American and Hispanic communities, especially in the southern US where we are in Houston, but also in New Orleans and in Atlanta, we're seeing very high rates of people in poor communities with diabetes and hypertension. And they're not so much in New York, but in other places, they're the ones winding up in intensive care units. So, and now we realize that the predictions are that this will move into the southern hemisphere as we reach northern hemisphere winter. It'll be summer, it'll be their winter. So we can anticipate seeing potentially large epidemics of COVID-19 in places like India or Bangladesh or sub-Saharan Africa. And this is going to cause a lot of devastation. And it's been a very hard message to get across because, if you want to get attention, there's nothing like having a disease in New York City to get attention. It's the media capital of the world, right? Getting that message out has been very challenging. One of the things we're doing is, of course, in our laboratory, we develop global health vaccines. And now we've had a coronavirus vaccine program for the last decade, recognizing that there is a health disparity component to COVID-19. And that's going to be very hard to keep on the radar screen because it's all about what's going to happen in London, what's going to happen in New York. And I'm very worried. How do you do social distancing in the crowded slums of Mumbai or Dhaka or Kolkata or Kinshasa? I don't know how you do that. So there will be a need to use much of the language and much of the imagery that we use for neglected tropical diseases towards COVID-19 if we're really going to address this. And the technologies that are being used are all being rolled out are very expensive technologies. RNA and DNA platforms and fancy delivery mechanisms. And, sometimes in my frustration, I disparage them as shiny new toys because they'll never translated to the world's poorest people. And that's why we're developing recombinant protein vaccines. So there are a lot of lessons learned from the neglected tropical disease community as we see COVID-19 move into Asia, Africa, and Latin America. An essential component of the neglected tropical disease ecosystem or movement has been WASH, right? I mean, how often have we, in every meeting in Geneva or London or Seattle, we talk that, again, these interventions are multidimensional and WASH is such an essential component for the control of diseases like schistosomiasis and soil transmitted helminth infections. And so many NTDs. And so therefore, we've been rattling the cage for 2 decades now on the essential nature of WASH for controlling neglected tropical diseases. And maybe it's going to be COVID-19 that'll push things over to the edge to make it happen. Access to clean water is of course paramount, and inadequate disposal of human waste is clearly a component of that. And there's even some evidence now for fecal oral transmission of COVID-19, but we don't know the exact extent of it. And there are differing opinions in the scientific community about how important that is.